It is Nurses Week, and this year's world theme is the Year of the Nurse, which certainly is timely in the face of the coronavirus pandemic. In recent weeks, we've seen national headlines about disproportionate numbers of Black people dying from COVID-19.
It is tough to see, and the stories shine a light on underlying health issues and healthcare disparities facing people of color. I had a chance to talk to some local nurses from Black Nurses Rock, an outreach group dedicated to helping create better relationships, awareness, education, and access to care in underserved communities.
When we think about what the CDC states as far as people who are at higher risk of getting very sick from this disease, is older people, people with serious chronic medical conditions, typically heart disease, including hypertension or high blood pressure, diabetes, and lung disease. These are more common in the African American community, right? So those are the things that they're seeing that can contribute to that. I know the famous Dr. Fauci has said that it's not the case that African Americans are getting infected more often, rather that the prevalence of underlying medical conditions such as diabetes, hypertension, obesity, and asthma has led to higher intensive care admissions and death rates among the African American community. I mean, with that being said, we're all at risk, but we can tell that we are more at risk of being more ill from the, getting the COVID-19 or coronavirus.
As far as in the community, as far as African American community, you know that as far as financial means, that's going to be a little strain within the community. So if you don't have a PCP, you should reach out to the healthcare departments to make an appointment. There's community health centers as well that's low income or free, as a matter of fact, to get treatment, and you can start there as well. Urgent cares is another place where you can go, but I think going to the health department or community health centers is a great start, because not only will you be able to be treated, but they will tell you where to go to get treated for COVID-19, but you can also establish a professional patient relationship and continue on that treatment for your other comorbidities that one may have.
What do people need to do moving forward, regardless of ethnic background?
Well, first of all, I would say don't avoid care. Go call your primary care physicians, call your healthcare provider for guidance. So you know your body, right? So I can't tell you that, this one specific symptom is for everybody. You know your body. So if you know that, hey, this is not the norm for me, reach out to them. Don't go and get seen. You need to be getting that information from your healthcare providers, especially if you're a high risk population, right? So if you have those other comorbidities, heart disease, diabetes, lung, asthma, different things like that, those symptoms, you can't just self-medicate. Those things that we normally do with this COVID-19 is not going to work, and it's just going to be progressively getting worse.
Have you been seeing people not taking it seriously enough? Just because as we move toward reopening, many people are anxious to get back to routines. How can we continue to take this pandemic seriously in the Black community and abroad, and to try to protect our health as we move further into the future here?
Well, I would say, I think we have to continue to be smart, right? Doing the basic things, washing our hands as often as possible, sanitizing them. Don't touch your eyes, your face, your hands. Cover your mouth when you cough or sneeze. And also, I would say continue social distancing as much as possible still. Wearing a mask when you're in close contacts with others. I've seen on social media and the internet how we've had these holiday gatherings, Easter gatherings, or I see people having these quarantine parties. We need to avoid unnecessary gathering as much as possible. And I think, staying home when you're sick. If you're sick, you need to stay home, because not only are you, at risk of, infecting others, but your health is very important too, and your family, right? And then I would say, we have to take it serious by, taking our vitamins and taking our health back into our own hands, doing those things that's going to help to reduce our risk for, not only COVID-19, but also the other comorbidities that we talk about, meaning, hypertension, diabetes, and other lung disorders and different things like that.
And it's a complicated issue. We talked about COVID testing access, mental health issues due to this pandemic, and much, much more. We're putting that whole Zoom interview on clickorlando.com. We're uploading it right now. We'll have it under News 6 at 9. That group, Black Nurses Rock, also recently volunteered to help with COVID testing, and they're making masks and donating them right now to Orlando Health and Advent Health locations, as well as the kids at Jones High School's Medical Magnet program. Julie.
Yeah, I can't wait to check out that full interview on clickorlando.com.